Okay. Hi, everyone. I hope this audio picks up okay. I am doing this in a location that I normally would not record a lecture, but I needed to get this out to you guys. This is going over the cardiovascular system. I have gone through here this PowerPoint and I have highlighted uh, things that I want you to pay particular attention to for the quiz on Thursday. Trying to kind of dial it in a little bit for you so that you have something a little bit more specific to study for. So anything that is highlighted in yellow is going to be something that you really want to pay attention to for the quiz. And then remember, I also said that I want you to be able to identify the high blood pressure medications based on the suffixes. So either the penes, the alols, the they're all escaping my brain at the moment. Sorry. So all the other ones. So that anything that's high blood pressure by those suffixes, those give you the ARBs, the ACE, the channel blockers. Okay, so the objectives for this PowerPoint is basically to just go over pathophysiology. There is a little etiology. I don't typically ever test on etiology, it's not etiology, it's prevalence. That's the one that I don't usually test on, but sometimes I do actually test on etiology, but you'll know what is actually likely going to be covered on the quiz by what's highlighted. So we're going to talk about these diseases. The cardiovascular system is basically your heart and your blood vessels. And the purposes of the cardiovascular system is to circulate oxygen, remove carbon dioxide. It provides nutrients to your cells. It helps to protect the bodies against disease, your white blood cells, of course. Stops bleeding at the site of an injury for the clotting factor. We have the clotting factor in our blood. It removes waste. So that's why people who have kidney disease have to go on dialysis because they're not able to cleanse their blood. And then it transports hormones and endogenous chemicals and hormones throughout the body. So lots of important factors there. The cardiovascular system, if it fails, what's happening is your heart is not contracting sufficiently, or there is a blockage somewhere, and we call that blockage atherosclerosis. So the diseases we're going to talk about are hypertension, heart disease, angina, and congestive heart failure. So per the CDC's website, I just pulled this off the other day, the leading cause of death is heart disease, and about one person dies every 34 seconds in the United States from some cardiovascular disease. So that's about 1 in 5 deaths were from heart disease in 2020. And these are risk factors. So you want to know this. Risk factors include, generally speaking, the male gender, older age, a family history of heart disease, hyperlipidemia or high cholesterol, hypertension, cigarette smoking, physical inactivity, obesity or being overweight, diabetes, mental stress, and depression. Hypertension is defined as sustained elevation in arterial pressure. So that is the pressure inside the arteries due to the amount of blood inside the vessel being greater than the space available. So think about a water balloon. When you start to fill up a water balloon, the edges of the balloon get tighter and tighter, and the more water that you put into a water balloon, the tighter and tighter it is until it's like sort of really pushing against the water balloon and it's really, really firm. And that's what's happening in our blood vessels is the volume of blood is pushing against the arterial walls, and it's a sustained pressure against those arterial walls. Blood pressure is regulated by the sympathetic nervous system and the kidneys. So that whole RAS system, the renin, the angiotensin cascade, that is a system happening that is initiated by the kidneys, or the kidneys are a part of that. So which receptors regulate blood pressure? Well, alpha-1 receptors located on smooth muscle tissue, they produce smooth muscle contraction. So blood vessels, sweat glands, eyes, intestines, those are also have alpha-1. So if alpha-1 is triggered, we have smooth muscle contraction or blood pressure would go up. Beta-1 receptors are located in the cardiac tissue, and that increases heart rate contractility. Well, if your heart is contracting harder and faster, that's pumping more blood through your arteries, and so blood pressure will go up. Hypertension, as the body's demand for oxygen increases, the blood vessels contract or dilate in order to direct blood to the area that's requiring that oxygen. Hypertension is when the force of the blood pumping through the arteries is too strong. That's just the basic definition of high blood pressure, hypertension. And factors influencing blood pressure. This is important. Cardiac output. So how hard and fast is your heart beating and how much blood is being put out? Peripheral resistance. That's the resistance of the walls of the artery, peripheral resistance. So think of the pressure, the resistance of the balloon itself, not the fluid that's in it. That's peripheral resistance. And then blood volume. So that's the fluid inside the arteries. If more volume, more pressure against the artery walls. So how does your body control blood pressure? And you will want to probably listen to the recording of Dr. Beggart when he kind of went over this. But basically, and I think this YouTube video might actually talk about the RAS system as well. So I recommend you watching this video as well. But we have there, and now that you've listened to the guest speaker, you know that we have a medication called an ACE inhibitor. Well, you can see that ACE is something that comes, it's something that comes from the lungs, and it's needed to convert angiotensin 1 to angiotensin 2. And angiotensin 2 is what triggers all these different mechanisms that end up with high blood pressure. So it's a cascade of events from angiotensinogen, which comes from the liver, then renin is deposited from the kidneys, and that makes angiotensin 1. And then we get ACE from the lungs, and that makes angiotensin 2. And then we have this reaction of all these different body mechanisms that can result in high blood pressure. So per these medications that we were talking about last Thursday, one of them is called an ACE inhibitor. It inhibits this ACE from binding. Therefore, it won't make angiotensin 2, and you won't have these results that end up with higher blood pressure. So in that case, it will end up lowering blood pressure. The other medication that was talked about is the ARBs, and those actually affect the angiotensin 2. So those block the angiotensin 2 receptors, and so those end up by a little bit farther down the flow of this mechanism here, blocks down here, therefore still blocking the mechanism that raises blood pressure, and in effect still lowering blood pressure. So I just like this chart because though there's a lot going on and it looks kind of confusing, if you stop to read all these little different pluses, you'll realize that those are just saying that these are stimulating agents which contribute to increasing blood pressure. So if we want to decrease blood pressure, then you have to interfere somewhere along those lines. 90% of all people with hypertension have no identifiable cause, and these are risk factors to high blood pressure, very similar to kind of cardiovascular in general. And high blood pressure can oftentimes be called a silent disease because people can live with high blood pressure and not feel sick. That's kind of similar to glycemia. You know, they can be hyperglycemic and not necessarily feel very sick. For treatment for high blood pressure, it's either medications or lifestyle modifications. The next one we're going to talk about is coronary heart disease, atherosclerosis. It's the thickening of the internal layer of the arterial wall caused by an accumulation of lipid plaques. These are phospholipids, and it results in diminished blood flow and oxygen supply to a portion of the myocardium, or the heart muscle, also called coronary heart disease. And cholesterol's role in heart disease. So we will talk a little bit about the lipids, the lipoproteins, triglycerides, and cholesterol. We don't get too in depth. There's quite a bit to talk about in this, and we'll just kind of give an overview. So the lipids are fats, and fats are important in our diet. They help to absorb certain vitamins can't be absorbed without fats. They're lipid soluble vitamins. And people can also, there's different types of nutritional talks about the lipids, but we definitely have to have a certain percentage of lipids in our diets. They're insoluble in blood, so they're transported in the blood in the form of lipoproteins. And a lipoprotein is a complex containing different percentages of the following: triglycerides, cholesterol, proteins, and phospholipids. So they carry them in different percentages, and they call them different things based on the percentages. Triglycerides are synthesized by the liver, and cholesterol is mostly obtained from the diet, but our bodies do make some in the liver because we do actually have a systemic need for cholesterol, and so our body makes some, but generally we get far more than we need through the diet. So the different types of lipoproteins, you have the very low density lipoproteins, or VLDL. You have low density lipoproteins. These are considered bad cholesterol. The LDL is considered bad cholesterol. And then HDL, high density lipoproteins, those are transported, those transport cholesterol to the liver, where the body eventually excretes it, removes it from the body. And so that is called good cholesterol. So I just want you to know the difference between bad cholesterol and good cholesterol. And then here's these little diagrams that basically, if you zoom in a little bit, you can see that the HDL carries a much larger degree of protein, and the LDL carries a much larger percentage of cholesterol. Here's a video that kind of talks about the buildup of plaques in the arteries. It's just another little good informational. So heart disease is the shrinking down of the lumen of the blood vessel due to the plaques. There's also complicated things that happen. There's these fibrins get deposited, so it's like a webbing. There's inflammation. They have found inflammation in the areas where there's plaque formation, and that sort of adds to the whole process. And it just decreases the size of the arteries. And of course, the big fear is that like a piece will break off and block it. Usually people who have sort of this very slow narrowing, your body kind of figures out ways to compensate a little bit. But chest pain starts to happen whenever oxygen is starting to be there's not enough oxygen getting to certain areas. And that's when people start to notice symptoms and pain and maybe shortness of breath. This is just another sort of schematic showing how if an area gets blocked or reduced blood flow, it can start to die. And that's when somebody would have a cardiac event. For treatments, reducing risk factors, lifestyle changes, pharmacological management, and sometimes surgery is also a part of managing heart disease. Different kinds of treatment: angioplasty, placing of a stent, or a bypass, where they take a vein from a part of the leg, and they graft it into the heart as a bypass. An area like blood will go here because this area is all clogged up. Okay, angina pectoris, this is highlighted, so I want you to see this area as well. Angina is when blood flow is decreased and the demand exceeds the need or the supply. Um, I think I said that funny. Let me say it again. So when blood flow is decreased and the demand exceeds the supply. Maybe I said that already. My brain just kind of checked out for a second. The outcome is ischemic pain or angina is what we call it. So, or ischemic, I suppose some people might pronounce it ischemic. Characterized by aching, squeezing, pressure, tightness in the chest. Usually that happens upon exertion or stress. Pain sometimes radiates to the left or right arm, neck, and or lower jaw. Totally, someone might think they're having a heart attack unless they know they have angina pectoris. And usually, if they know they have angina, they carry nitroglycerin. You've noticed I've highlighted this. This is in red. It's a medication you need to know about. Patients who have angina have to carry their nitro tabs. And if somebody has an episode of an angina attack, they would take their nitro under their tongue. And if it doesn't go away, they would do it again and then a third time. And if it still doesn't go away after they've given themselves 3 doses, then the medical emergency review would be to call EMS. Congestive heart failure. Heart failure is the most common Medicare diagnosis. Heart failure is primarily a condition of the elderly, and 5 million people in the United States have heart failure. Any condition that causes myocardial necrosis or produces chronic pressure or volume overload and myocardial dysfunction, those are all part of sort of the diagnosis of congestive heart failure. It's an inability of the heart to function well as a pump. So I highlight that because I want you to understand that a simple way of thinking about congestive heart failure, it's the inability of the heart to function as a pump. And causes can be contributed from hypertension and different, heart disease, atherosclerosis, and that sort of thing. Signs of congestive heart failure: perceived shortness of breath. Dyspnea is shortness of breath. We love that word so far this semester. Exercise intolerance. They just can't, they get winded going upstairs or taking a walk or whatever. Fatigue, feeling tired. Edema is fluid accumulation. You'll notice that a lot in the legs and sometimes in the abdomen. Weight gain or increased size of the abdomen. Here's what edema in the ankles look like. You push on it and the dimple stays. So just want you to be very familiar with the word edema and what it's referencing to. Congestive heart failure treatment, you have to treat underlying problems such as hypertension, atherosclerotic heart disease, diabetes, and then behavioral modifications: smoking cessation, weight control, exercise, adequate rest, avoidance of alcohol, and late stage, in the late stage, salt restriction as well. Congestive heart disease, possible medications. This was not in our guests' PowerPoint, but I do want you to know this. You have to know this because it affects our oral health care very specifically. So I put it in this PowerPoint and you will likely be quizzed on this. So I want you to know this. Diuretics may be used in mild congestive heart failure. Our guest told us about that, loop diuretics. But also to increase the heart's contractility, so how hard the heart beats, digoxin or digitoxin or digitalis. This is something else though, digitalin, but digitalis is another. There's lots of different ones. Lanoxin, but digoxin is a commonly used phrase. But one thing it does is it can cause GI upset and make patients feel extra gaggy. So if a patient takes digoxin, they may gag easier, say when you're taking x-rays. So that's really super important for you to know. Other possible medications: vasodilators, ACE inhibitors, beta blockers, and different sympathomimetic drugs. So I'm not sure that this is actually true. This was just it says discussion for next week. What type of cardiac medications can cause gingival overgrowth? What types of cardiac medications can cause a lichenoid reaction? what is a lichenoid reaction, how many cartridges of local anesthetic can be safely administered to a patient with cardiac condition. I think you should answer these questions, and but I don't know that we're gonna have time to specifically discuss them next week, but I definitely think you should answer those, and I can post the answers somewhere in Moodle, because this is all stuff that would be you may be tested on. And so I obviously want you to pay attention to these topics here. All right, that is it for this recording. Pay attention to the highlighted slides, and know your high blood pressure medications as they relate to the suffixes on the guest's PowerPoint. And I will see you guys very soon.